Hello everyone, I'm Julie. For our Physio Friday for today, I'd like to discuss about upper cross syndrome. So when we say upper cross syndrome, we're talking about group of signs and symptoms affecting our upper body. So with upper cross syndrome, we have tightness because of the position of the body. If you could see it in the lateral view, with upper cross syndrome, our cervical extensors are tight. They are in our head, are in forward head, and our shoulders are in kyphotic posture or rounded shoulder. So our shoulders are in protracted and internally rotated. So with this problem, what we do in the clinic is like we try to release or stretch the tightness, and we strengthen the weak muscles. With regards to strengthening the weak muscles, since I said like our head was in cervical extension, we'd like to correct that by doing cervical flexion. So what we do is in sitting position. So if you are working during the day, you could do between your break, you could just do some chin tuck exercise, like you will just pull your chin backwards. So what not to do with this exercise is you should not do nodding, but rather you tuck it in your chin. So you could see the double chin when doing this exercise. So your shoulders should be relaxed and do this chin tuck exercise. You can hold that for 6 seconds, do 10 repetitions, and you can do 2 to 3 sets. So that's one of the strengthening that we can do. And second, with upper cross syndrome, we have some weakness in our area, in our upper back because of this position. So what we do is we try to strengthen that one, to correct that one. And so one exercise we should do is we can pull our scapula together, squeeze them backward, and we can do hold also. 6 seconds hold and 10 repetitions. I also mentioned a while ago, with upper cross syndrome, there's weakness or tightness. So what we should do with tightness is we try to release by doing some stretching exercises. So with upper cross syndrome, we have some tightness with our upper traps and levator scapulae. So one stretching we could do is we will release this side of our neck by doing stretching. You put your neck or your ear towards your shoulder, and you could stabilize this side to avoid some compensation. You could stabilize it holding at the side of your chair, and you could pull it towards your side. Hold that for 30 seconds, 2 to 3 repetitions, and you could also do that at the other side. Next is almost same with the first one, but you will rotate a bit, for like 45 degrees rotation, and do this. And you can also pull your heads toward that side and stabilize your opposite shoulder to give that good stretch at that side. In this stretching, we are stretching the levator scapulae from the base of our skull to our shoulder blade. So that's our stretching for the neck. And I also mentioned that with upper cross syndrome, our shoulder is in protracted posture and internally rotated. So I'd like to teach one exercise to release the pectoralis tightness here. So you could go to a corner in your room for you to be able to do that. So both hands could be against the wall, and then you will just lean forward. You should be feeling the stretch in your chest. And you can hold this position you can also hold that position for 30 seconds, 2 to 3 sets. So those are just few exercises that we do with upper cross syndrome. If you feel like you have this upper cross syndrome, please don't hesitate to call and book an appointment. Thank you.